Have you ever heard somebody saying that a pregnant mother must lose a tooth every time she's pregnant? That is, every pregnant means loss of a tooth. Is it a myth or a fact? I think this is very, very important as we are going to look at issues to do with oral health. And not only the teeth, but other related concerns that you may have today. And to take us through this is Dr. Wangari. She's going to introduce herself further and tell us, are these myths? Are these facts? What do we need to do? Where do we start caring about our teeth and our oral health? There are so many things around that, around our health, our oral health, that we need to talk about today. So sit back, wait for us. We go together in terms of caring for our oral health. Karibuni sana. And today, as I have said earlier, I'm so excited to have a dentist. She's going to introduce herself further and tell us what other things does she do in her line of duty, and where can we be able to improve on our oral health. What are some of those diseases that she's going to tell us? She's practicing on that, and she's going to do that. I'm so excited. This appointment for today, this episode, we planned it like 2 years ago, and today we are able to come to your house, to your place where you are, so that we can give you and share this information with you. Karibuni sana, and karibu daktari.
Hello everyone, my name is Dr. Wangari Veronica. I am a consultant periodontist. That is a dentist who has specialized in diagnosis, treatment of diseases that affect the gum and the bone, what we call periodontitis. I am a practitioner at Kiambu Specialist Doctors Plaza in Kiambu, and at the same time I'm a lecturer at the University of Nairobi School of Dental Sciences, where I teach periodontology and implant dentistry.
Wow, it's really a mouthful.
Yes, it is.
It's a mouthful.
It is.
And that is your area.
Yes, it
and
is.
I'm excited to host you today.
I'm happy to be here.
Yes, really, really excited, because I believe that our viewers are going to learn one or two things and do away with some myths that we have had as we've been growing up, and we have been living with our teeth and dealing with our mouth. So there are so many things that we've had that are not true. Mm-hmm. And I'm so happy to be with a consultant. It's so hard to get a consultant on set, but today we are excited to have you here with us.
Honor.
Karibu sana.
Thank you.
Now, Daktari, issues of teeth. Where would you like us to start from?
Maybe we can start from as early as pregnancy, because our teeth get formed in our mother's womb. That's when you make your first teeth. They start getting formed at that point.
Yeah.
When you're in the uterus, and during the whole pregnancy, your teeth are forming. So by the time you see a tooth erupting into the mouth at 6 months, that process started at 6 weeks of pregnancy.
6 weeks.
Yes. So that means that even as mothers are going through pregnancy, the things that they do can affect the future dentition or the future teeth of children. If I can give an example of a very common condition, what we call fluorosis or brown teeth, the child actually gets affected or exposed to high fluoride levels inside the womb of the mother. So when the teeth erupt at 6 years of age, the first incisors, these teeth that we call the incisors, and they erupt looking brown, it means the exposure happened a long time ago because of the water the mother was taking, the food that they are taking, or whatever they were exposed to. In fact, very interesting, if a mother has had a severe disease or infection during pregnancy, it can actually present in the form and structure of the tooth. That's how connected the pregnancy is to the teeth that we see.
Where?
Yes.
Where?
Very interesting, isn't it?
Yes, it is.
Mm.
Yes, and very, very, I mean, this is information that is very good.
Yes.
Yes.
So we tell mothers, and ideally and I hope as we progress in increasing our community awareness, that people will go for pre-pregnancy screening. We should get to a point where when you plan to get pregnant, you go and visit your dentist. There's information that you pick up that will help you in the course of pregnancy and even help your child later.
My eyes are popping out. Are popping out because we've been talking with the gynecologist, Dr. Maina,
Yes.
Mary Maina,
Yes.
and she talked about preconceptual care
Yes.
and of mothers who are expectant. And now I'm hearing Dr. Wagari saying you need to go for that kind of, attention
Yes.
with your dentist.
Yes. That perception care is not just for the gynecologist. It's also just like the way you go see a physician if you have an ongoing medical condition, and also the dentist, so that you get information that will help you in the course of pregnancy. If I may say, pregnancy, a lot of people come and say that, I have had 6 children, therefore I have lost 6 teeth. That every time I'm pregnant, I lose a tooth. Yeah, right? You've heard about those myths.
Yes.
But is that really true?
I don't know.
I mean, we have been pregnant. We didn't lose any
I didn't lose.
Neither did I.
I have 2 babies and I didn't lose my teeth. I'm still having my full set. Okay, one had an issue later, but not when I'm necessarily for
not
that.
In pregnancy.
Not in relationship to pregnancy.
Exactly.
Yes.
So what is this that makes some women lose their teeth then? Is it because pregnancy itself is a predisposing factor to tooth loss? Not per se, if I may say so. So what usually happens is that pregnancy is a difficult period and a very special period for the woman. From the time they start getting nausea in the first trimester and, heartburn.
Yes.
Can you imagine having hyperacidity all the time for 3 or 4 months of your life?
Yes.
That hyperacidity in the stomach comes back into your mouth. So it ends up eroding your teeth, or it increases the acidity level in the mouth. So for you to say that you have had a cavity form, you need 4 factors. You need time, exposure to sugary things, and then you need acidity. Low acidity levels need to be ideal, and then you need food that is, have I said food already?
No, you've said.
I've said bacteria, and then you need bacteria that causes the caries. Bacteria that cause cavities eat sugar, or they digest sugar. So in pregnancy, what do? We eat sweets to take away the nausea, to take away the bad taste in the mouth.
The cravings. And
then the cravings come in and you just want to take something sweet and sugary. So what you already ticked, the bacteria are present in your mouth, and then now the sugar levels have increased, and then you're pregnant for 9 months, and then the acidity has already increased because of the factors that come with pregnancy.
The environment.
The environment. So if you had a small cavity, it progresses faster. You see? And that by itself leads to people getting cavities that are now painful during pregnancy. Then the other thing very unique about pregnancy,
yes,
it lowers our immunity.
Yes.
Yeah, I mean, I'm sure you've talked with Dr. Maina.
Yes, we did slightly. We didn't finish the issue of the pregnancy.
Okay.
Yes.
So by lowering our immunity, it means our body is less capable of fighting off
diseases and illnesses. Yeah.
And then the hormone levels go so high, the hormone that we call progesterone and estrogen.
Yes.
And that goes hand in hand with swelling of the gum. So you find in pregnancy the gums swell much more. The tissues react more robust than they would react if you're not pregnant. And therefore that means that many women end up getting what we call gingivitis, which is swelling of the gum, bleeding gums. Or if you had already gingivitis, then it gets worse, especially when you get towards the second trimester.
I think, Daktari, just look at this camera.
At this camera.
And tell us those gingivitis.
What is gingivitis?
Yes, tell us what it is, because I'm imagining there are other people who are like gingivitis. Probably I experienced that, and then they are like, kumbe ni hiyo. So probably just look at the camera and
Okay.
talk to us.
Thank you, Jane.
Yes.
So gingivitis is inflammation of the gum, the gingiva. What you see, when you smile, this pink structure that you're seeing here is called the gingiva.
Oh, okay.
And then underneath there, you have the bone, and then we call the periodontium. So in pregnancy, because of the increased hormonal levels, the gingiva swells. There is increased blood supply everywhere in the body, not just, in the uterus, but everywhere.
Yeah.
And so pregnancy women will end up getting more bleeding gums. Sometimes they get pain in the gums. So that means if you feel pain, are you going to brush your teeth?
No.
Exactly. If you don't brush your teeth, then what happens? The bacterial levels shoot up.
Okay.
Then the disease keeps progressing. So already that pregnancy, the state of pregnancy means that the woman is already predisposed to getting much more gingivitis and progression of dental caries, which is cavities. Dental caries is cavities because of those 4 factors that we've talked about. So let's say a mother comes in for preconception care to the dentist.
Yes.
We'll be able to feel any cavities that are there. And if you need cleaning, what you call scaling, to try and manage the gum and keep the gums healthy, then we do it.
Okay.
That means you're going into pregnancy ready without any infections, which is very important. Yeah. So gingivitis occurs because we all have bacteria in the body, but if the bacterial levels get to a point where they are getting much more, then you get a shift of bacteria from the normal to something which causes disease, which causes breakdown of our gingiva and our bone. So when you see that bleeding gums, that swollen gums, and for some people they start getting shaking teeth, some people lose their teeth, it's because of gingivitis becoming periodontitis. So our disease now moves from just affecting the top part and goes under into the supporting structures, which is the bone and what you call the periodontal ligament. And when that starts, that process is normally managed by the procedure we call scaling, cleaning, meaning we try and reduce the amount of bacteria that you have by cleaning this surface here of the teeth and below the gum. So that is what gingivitis is and periodontitis.
Yes.
So periodontitis unmanaged for long, people will end up getting teeth falling off because they were shaking. Because you see, the bone that was supporting the tooth has been destroyed. So the tooth starts to shake and some people lose their teeth. Or the gum pulls down. Instead of having gum with gingiva, gingiva is the gum, which is at this level, at the neck of the tooth. Then gingiva moves upwards. So people start having longer teeth, correct?
Oh, yeah. Unaona
Imerefuka.
imerefuka. It's like it's sharper at the end.
Yes. And then also the way the teeth bite nicely like that,
Yes.
it changes because now the teeth shift forward.
Oh.
So you start seeing, when you look at somebody, you can see their teeth through their lips. But it's something which was not happening
was not
before.
there before. Okay, so they kind of protrude.
Yes. That's because of advancing periodontitis. Because the support, what supports the teeth, has been compromised by the bacteria and by the ongoing inflammation. Yes.
Well, okay.
Now, in pregnancy,
yes,
the most interesting thing is that there are many studies that have been done.
Yeah.
That if you have periodontitis in pregnancy, it increases your risk of getting early labor, what we call preterm birth, getting children who are small for their age.
Weight.
Yes.
Small.
Small. So and then also children who have low birth weight at birth. So already the evidence is so robust and so heavy that periodontitis, other than just causing the damage in the oral cavity, because of that, the bacteria cause a lot of reaction. The body reacts so much to that bacteria. So you have a lot of what we call, like soldiers, soldiers that are sent released from the oral cavity.
Yes.
They are called cytokines. And they are in the bloodstream and they go to all the organs and they actually trigger or increase the risk of getting preterm birth. Can you imagine?
Wow.
Everything else has been ticked that you are okay, and then the periodontitis has increased your risk.
So you end up having a preterm baby,
Yes.
but you would not have known
Yes.
it was contributed by the bacteria.
By the bacteria and the periodontal infection, the periodontitis. Yes.
I can't dare to mention that word.
It's difficult.
Yes,
Periodontitis.
but just let us leave it at your bacteria.
Yes.
And then affecting. So it's not just normal to have, like, it's every other box has to be ticked, including the dental care for the mother.
It's very important. Because of those three things, diseases progress faster, the cavities progress faster, gingivitis also progresses faster, and then now there is also the effect on the fetus. And at the same time, things like now environmental factors, exposure to water, smoking, alcohol, things that will affect the baby. Yes.
Where?
Can you imagine?
Where? Hey.
Yeah.
Quite good. Let's go on.
We go on. Yeah?
Yes.
Yeah. So now, another myth I think that we should address.
Yes.
People say that pregnancy reduced my calcium levels.
Oh.
Yes. In fact, the reason I lost my tooth is because my calcium levels went down because the baby needed the calcium.
So yeah, that I think I've heard that.
You've heard that one.
That the baby sucks the
calcium.
The calcium.
Therefore, that's why the teeth, the cavities are progressing. So I think I've addressed that. The cavities are not progressing because of calcium. It's because of the things that we get exposed to during pregnancy.
Yes.
Right?
Yeah.
Because by the time the calcium in the tooth is removed, in fact, it has been shown it is the last, if it's a last cell in the body where calcium is removed from. If ever you need calcium. Yes.
And okay, I've had people being added when you're pregnant. You kind of advised to take some calcium or something.
Supplements. Yes, those are necessary because you need them for your long bones and for normal function. And I think the gynecologist, I'm sure, addressed that one.
Yes, those ones. Yes. Yes.
But it's not really for the teeth. The teeth don't get affected that easily.
Oh.
And this is why a tooth takes 3 years, almost 6 years to form. That means the structure is so solid. By the time you're getting that calcium, and it's not free, it's bonded to other molecules, to be almost impossible to remove it, to go into the circulation because the baby needs it. The reason cavities get worse is because of habits, and habits like avoiding brushing because you feel like vomiting, increased hyperacidity because of the reflux and the baby growing, and also because of the diet. So what should we do? How do we prevent and take care of ourselves then during pregnancy? So one, and I know it's normally very difficult when someone is pregnant and you tell them brush your teeth, they look at you like, what?
Yes, now you're going to tell us, doctor, tell us to brush our teeth.
And I say every time I brush, I vomit. I can't stand the taste of toothpaste. You know how pregnancy is. So
you only the spell, you spell or throwing up all the time.
Exactly.
Yes.
Exactly.
Yes.
So, but it is still very important because there has to be something that disrupts the bacteria from attaching to the tooth. That's why we brush our teeth. We brush our teeth to disrupt the bacteria from attaching to the tooth surface. So that toothbrush must go into the mouth. Even if you cannot stand toothpaste, you don't have to use toothpaste. You can just brush with just a normal brush if using that toothpaste is going to make you stop brushing. And it doesn't have to be this commercial brush. It can even be a chewing stick. What we want is that we don't want the bacteria attaching to the tooth surface for long periods of time.
Yes.
Because if they do, then they change. They become more pathogenic or more destructive.
Yes.
Yeah. So we need to just get a stick, put it in your mouth. Or maybe eat foods that are abrasive, like sugarcane. Because even in the process of eating sugarcane, you have removed the bacteria. It's like you're brushing, you know?
So sugarcane, because I like it even when I'm not pregnant.
It's very good. It's very good. Yeah.
Yes.
And then we avoid, because there's that urge to snack.
Yes.
to keep the nausea down.
Mm-hmm.
So you try and choose snacks that don't release sugar, direct sucrose, you know, like sweets and like sugar, the one in the nini, chocolates,
Yes.
candies, because those one release sugar directly into the tissues. So if you can choose an apple as an alternative, then it's good. And if you must eat those sweets, if you have decided that sweet is what you want, no matter what, then use a brush after that, or gargle water. Wash away that sugar. If someone has bleeding gums in pregnancy, the reason the gums are bleeding is because the bacteria is increased, and also because of the pregnancy factor. The way to take care of bleeding gums is to still brush those teeth. You disrupt the bacteria.
Brush the teeth.
Brush the teeth.
Yes.
Try. Even, we usually tell people brush twice a day.
Yes.
But we understand this is a unique period.
Yes.
Even that once, it's still better than not doing any of it. Sometimes we give people mouthwashes to gargle. If someone is completely unable to brush their teeth, we give them mouthwashes that help reduce the amount of bacteria again. But the eventual and the main way of managing bleeding gums, swollen gums, is by disrupting that bacteria, and it's by brushing, either with a normal toothbrush or a chewing stick, and with or without toothpaste. I know some people even use salt, and it's still fine.
Okay.
Yes.
So salt can still serve the same purpose?
It does.
Okay.
It does, because it reduces also the bacterial levels.
Wow.
Yeah.
So even those of us who are not pregnant, I think we can still use that one when sometimes you feel you need to do that?
Yes, you can. But remember what I said, the long-term management of, and maybe we talk about it when you go into what causes gum disease.
Yes.
You see, we all have bacteria, like I have said.
Yes.
But the bacteria change and become more destructive. And as they become destructive, bacteria form a substance that usually lines the tooth surface. If you were to touch your teeth with your tongue in the morning, or when you haven't brushed for some time, they feel slimy. That slimy substance is called plaque. Plaque.
Yes.
Plaque is now organized bacteria. And the organized bacteria must be removed with something mechanical like a toothbrush.
Yes.
But then when plaque stays for a long time, it gets elements like calcium from saliva, and then it starts to harden. So it attaches on this surface. The most common surface to attach is here.
Okay,
on the inside.
On the inside.
Because there's a lot of saliva here.
Oh.
And on these first molars on the outer side.
Okay.
So if you notice, some people will have white deposits here. Sometimes they turn blue, they turn black, green, greenish in color. We call that calculus. So when that calculus stays there, it allows the bacteria to keep adhering there, to stay in constant contact with the gum.
It's like a friendship.
Kabisa. In fact, they bond to the tooth so tightly, so you must come for cleaning, what we call scaling, so that we can remove those deposits. So the management of gum disease is by doing the procedure called scaling, to try to remove those deposits, and then to leave the tooth surface smooth, so that you can be able to brush it comfortably. Yeah.
Wow.
Wow. So what happens if we leave them there long enough?
They harden the tooth?
They don't harden the tooth. They push the gum pulls away. No, it's an irritant to the mouth, and our bodies react by pulling away from irritants. So if you have a deposit here, the gum is just going to pull away from that deposit. That's how teeth become longer.
Kind of inatorokea.
Yeah, those bacteria.
Those bacteria.
Because it's irritant.
Oh. Okay.
And it does that by damaging the bone underneath.
Yes.
So now the support for the tooth goes down. The teeth get longer, the teeth start shaking. Now together with the bleeding gums.
Yeah.
And then you can imagine if you have something that is harboring bacteria for a long time, and your gums are bleeding, the next thing, bad breath.
Of course.
So people complain of bad breath.
Yes.
And sometimes we get so used to it that someone might think that it's normal.
It's a normal smell from the mouth.
No, it's not.
It's not.
It's not.
It's a disease.
It's a disease.
Yes.
Periodontitis.
Yes.
And management of periodontitis is very simple. Scaling. You come, we do cleaning for your teeth, and we usually say once a year, come for cleaning. That way we'll maintain your teeth to look like this.
Very nice. Very nice. Very
Yes,
nice. Very
yes.
nice. Wow. All that is in pregnancy.
That's in pregnancy and even people who are not pregnant.
Who are not pregnant. Okay.
Yes.
Now, tumetoka kwa pregnancy.
Yes. Twende kwa watoto.
Sasa tumezaa. Tumepata mtoto.
Yes.
Haya. Because at 6 weeks, you said the teeth started developing. So now, mtoto amezaliwa. We have delivered a bouncing baby boy, bouncing baby girl. Take us through the steps about the teeth and the conditions and the concerns that are around there.
Okay. So, you know, newborns are born without teeth.
Yes.
They are the easiest to manage.
Okay.
Right?
Yes.
Because they only breastfeed,
Yes.
then they sleep.
Yes.
And we know in that period, the 4th trimester, people get used to breastfeeding. Mtoto analala. You
Yes.
breastfeed, the baby sleeps. Breastfeed, baby sleeps. We are not used to cleaning baby's teeth, right? So when the teeth come out into the mouth, this is not something that you are used to.
Okay.
Right? So the parent now must start being aware that now the teeth are in the mouth. We must start finding a way of keeping the teeth clean and with minimal bacteria levels. Yeah. So I usually advise small babies, because you cannot introduce a toothbrush into a small baby's mouth. You can get a piece of cotton wool or like an earbud and you wipe the teeth. The purpose, remember, is always to disrupt the bacteria.
The bacteria.
Yes.
Yes.
So that's what we do for young babies. You ask the mom to just brush, to clean with a warm cotton wool, especially when they start. See, 6 months already, the baby is weaned.
Yes.
So even if you want to introduce water, it will not be an issue.
Yes.
Then you start encouraging them to take a sip of water after you are done breastfeeding. So the mother breastfeeds. You make sure the baby has swallowed the milk, and then if possible, they gargle, they take a sip of water. The sip of water is just to wash out the milk from the mouth. So why is it dangerous when milk stays in the mouth? If a baby, breastfeeds and they sleep with the breast in the mouth and the milk in the mouth.
Sometimes mothers will be breastfeeding as they lie.
Yeah.
On either on the bed or on a seat.
Yes.
So the baby sleeps, the mother sleeps, but the breast is still in the mouth of the baby.
That means there's milk.
There's milk
in that mouth.
Yes.
Yeah. Milk is, when we break down milk, the first component is sugar, sucrose.
Yes.
And remember we said sucrose causes breakdown of teeth. So the danger of leaving milk in the mouth is because milk ferments and releases sucrose, which is sugar. So I was saying, when it's one off, it may not be significant. But when it's constantly happening, and I mean breastfeeding happens constantly,
yes,
then it means that those teeth are constantly exposed to sugar, right? And as long as you're doing brushing and the baby's not sleeping with milk in the mouth, then most babies will be able to keep their teeth healthy. And on top of that, we avoid introduction of sugary things like sweets, lollipops, the way they love them, and chocolates, and yogurt. Yogurt is fermented milk, correct?
True.
And it is sweetened.
Yes.
And babies love yogurt. We also like giving them yogurt. And because it's healthy.
Yes.
But constant yogurt giving, and then the baby stays with the yogurt in the mouth a bit, means that you're exposing them to the sugar.
And then the development of bacteria.
Yes.
The growth.
And as sugar increases, sugar gets broken down, acidity levels increases. The acidity levels lowers. It's actually low pH. The acidity in the mouth is low, which allows the bacteria to grow faster. So they start getting cavities early. It is very sad when you see a 1-year-old who already has cavities or teeth that are looking brown. They start by looking brownish in color, and then they start breaking down. Small baby teeth starting to break down. And most of the time, the cavities can start on the surface here, or they can start in between. So how we avoid this is one, that when you give a child breast milk, you make sure that they have swallowed and they have rinsed out. And we avoid feeding. If you have to breastfeed at night, then you do it when you're upright, so that you also ensure that the baby has swallowed. The second thing that we do when we go back to work is that you now move to the bottle feeding.
Yeah.
And this is breast milk. But again, if the baby stays with that bottle in the mouth until they fall asleep, it's the same effect as having the breast in the mouth.
Yeah.
There's milk that's accumulating, and it breaks down and cavities start again. So bottle feeding is also a big risk factor, and especially because it is pretty common, because most mothers tend to go back to work and you need to feed the child.
Yeah.
And also bottle feeding at night and breastfeeding at night, same thing, because the baby will sleep when they have milk in the mouth. Okay?
Yeah.
And then the other thing is the baby needs to sleep in the afternoon. They have had lunch.
Yes.
They're going for their nap,
Yes.
or the 10 o'clock nap.
Yes.
10 a.m.
Yeah.
And what do? We give them milk.
Yes.
Or we give them yogurt.
Yes.
And we tell baby sleep. But that mouth has slept when it has sugar in it.
Yes.
So that constant exposure eventually will lead to breakdown of teeth.
So what, doctor, you are saying, before this baby falls asleep, after feeding, let's give them water.
Yes.
So that it can neutralize or clean the teeth, the mouth.
Yes.